Hey, what's up, everybody? This is Josh Burnett. I want to welcome you to another hashtag Celebrate Columbus show. On today's episode, we talk to Bartholomew County Health Officer, Dr. Brian Niedbalski. You've probably seen and heard his name throughout this year, especially with COVID-19. He's been very busy. His office has been, I'm sure, busier than they've ever been. And on today's episode, we celebrate healthcare workers. We also talk about the COVID-19 vaccine, and we talk about what we can do as a community to support local healthcare workers. Thanks for enjoying this episode of the hashtag Celebrate Columbus show. Thank you so much, Dr. Niedbalski, for coming on the Celebrate Columbus show. Obviously, this year has been one of, if not the hardest year of healthcare in our community. And, as you look at this year in reflection at the end of, we're recording this about the end of 2020, been many ups and downs, and I'm sure everywhere in between, like a roller coaster. What has it been like for you as our county health officer, and as well as, practicing physician in our community? What's it been like, the goods, the bads, and the uglies?
Well, personally, I think the major positive has been working with so many members of our community in the COVID-19 task force, trying to do what's right for the better good of the community. Even though some of those recommendations haven't really been accepted with open arms, we've been trying to do our best here over the last 9 months. I've had the opportunity to work with representatives from CRH, city and county governments, the school corporations, the local business sector, just people that I probably wouldn't have an interaction with at any other time if it wasn't for this pandemic. I'm also proud of the work that our county health department has been able to accomplish during these unprecedented times. Our nurses have been testing now for COVID-19 for several months, in addition to their other responsibilities. They're starting to prepare a vaccination clinic when that vaccine is going to be available to the general public, which will hopefully be sometime soon. Our health inspectors have been working hard to encourage proper mask wearing and capacity limits in local businesses and restaurants. So all those have been, great positives that I've seen here during the COVID-19 pandemic. Probably the negatives would just have to be the sheer impact that we've seen on our local health system. The hospital staff has been pushed to the limits on several occasions, most noticeably here over the last several weeks, with not only the sheer number of COVID patients that have been admitted, but this is the time where we see a lot of sick people in general. So they've really been stressed.
Yeah, I can't imagine. I've seen some of the different posts as well as articles in the newspaper about, the capacity of our hospital, whether it be COVID related or not, that's been pushed to the max. And, I know from being in a lot of those meetings with you, with the COVID-19 Community Task Force, that each of the decisions that you have to make are really difficult. I've noticed, and maybe you could speak to this a little bit, a lot of the decisions you've had to make have been, we as a community have never had to make before. And, you spoke to, some of them have not always been, 100% accepted with a smile on your face, but I've listened to how you make your decisions, and you really do think about everyone. Could you talk a little bit about, the difficulty of making those decisions, and, how you make the best decision for our community?
Well, luckily we have a lot of people on board. Not only myself as the county health officer, but we've got Jim Bickle from CRH. We've got the mayor. We've got representatives from the county commissioners. So we've been trying to do what we feel is best. And like you said, there's a lot of times where not everyone is on board, and it's more of a majority rules, but I think everyone has come to a common understanding of why we make those decisions, even though they may not agree with it. And some of those decisions have been extremely difficult ones to make. And And one of the things that we've seen is some of the decisions that were very difficult were whether we were going to have schools open or not. And
Right. Yeah.
then it became, when are we going to close schools or go to virtual learning, not close them, but so we would have those meetings every few weeks, and depending on the numbers that we would see, and you know, you can't please everybody. We would have one side of the table upset one way or the other. So those were some of the things that we had to deal with here over the last 9 months.
Yeah. And I know, speaking for someone who's, part of one of those organizations, but also as a community member, something that I've learned just as I get older and, have a family and work in the community, it's like you do the best that you can, you work hard, you give it your everything. And at the end of the day, you have to trust that because you made the decision with several people, you've got experts from all these different fields. I think that's just something that I think I'd like everyone to know, is that we've got a great county health officer that doesn't make decisions by himself. You hear that phrase that we've heard oftentimes: if you want to go fast, go alone; if you want to go far, go together. But I think it also applies to making decisions. If you want to make something that's in your best interest, go for it by yourself. But if you want to do what's best for everyone, you've got to get stakeholders involved and at the table, and sometimes have hard discussions. But at the end of the day, do what's best for everyone. So thank you for doing that. Let's get into a lot of the positives though now, because I've seen some things, whether it's a group of people coming to CRH and honking their horns in support of healthcare, or having banners all over the community celebrating our healthcare heroes. For you, being in the medical field, what have been some of those positives that you've seen from our community and experienced in the healthcare field?
Well, yeah, you mentioned that. I'd almost forgotten about that prayer vigil, I think it was, when everyone showed up at CRH. That was really early in this whole process. Um, I've had cards sent to my office just from random people expressing some kind words for all the hard work that we're doing. So I really appreciated those cards. Also, just the people here in the community in general. I think that none of us are immune to the effects of the pandemic, but everyone that's been putting forth the effort and sacrifice of whether it's wearing masks when you're supposed to, avoiding those gathering sizes, or limiting gathering sizes, I should say. People have missed out on weddings, people have missed out on sporting events, graduations. Everyone's been putting forth that sacrifice, and everyone's still willing to do their part, and we're not out of this by any means.
COVID-19 obviously been the dominant conversation in our community and really in our nation for this entire year. It's been a very busy year in many ways, but it's just been so different with COVID-19. Recently, I was reading about how the vaccination has come to Columbus now. And could you talk a little bit about that? And, have you received that yet?
Yes, well, we were lucky enough to get our first shipment this past week, and several of the frontline doctors got the first vaccines on Thursday, I believe it was. I was lucky enough to get mine on Saturday. And other than my arm being a little bit sore for a day afterwards, I've had absolutely no side effects. And I think that we've had a good number of staff and physicians that have stepped forward and received their vaccine. So that's great news.
So with you receiving the vaccine most recently, just this past week, and, trying to figure out the timeline over the next weeks and months, could you give us a little bit of an update of what you may project for how it's going to go in our community and what we can expect for the future?
Sure. Well, right now we're doing the frontline workers healthcare. Once that phase, I guess you can call it, is finished, There's still some decisions that are going to have to be made on who's going to get it next. It's beginning to look like that's going to be the elderly. What the age cutoff is going to be, we're not exactly sure just yet, but that will be coming down from the federal and state government levels. And also probably people that are at higher risk or immunocompromised, like cancer patients, people who have heart and lung disease, those people will qualify. Now, we don't know what the exact timing will be, but from what I've been hearing, I'm guessing that's going to be sometime in late January. So, as we move forward, we need to realize that, the vaccines are going to be the game changer here. We really haven't had much to combat the virus other than wearing our masks and avoiding those large gathering sizes. Basically, as we go forward, if a majority of people can get vaccinated, that's going to be the most important step we can do in getting back to a sense of normalcy.
Well, speaking of the vaccination, healthcare workers, and getting back to some sense of normalcy, one of the things that I would like to do through the Celebrate Columbus show is not only, celebrate our healthcare workers, but to contribute and really help them in any way we can. Obviously we've got some very normal things that you just spoke of, but how can we as a community support healthcare workers during this pandemic?
Well, we still want everyone to follow our recommendations for mask wearing, when it's appropriate, and practicing social distancing. I suspect that those guidelines are going to continue through most of 2021. But really the most important thing going forward is going to be, have that willingness to get the vaccine when it becomes available to you.
Well, if people would like to learn more about the COVID-19 vaccine, where are some places that they can go to learn so that they can make that decision?
Well, first off, I'd recommend cdc.gov. There's a lot of information there that's accessible. At a local level, our community task force website or crh.org also has some good information available.
Well, before we go, a question that I like to ask at each of these episodes, is not only, obviously we're celebrating healthcare workers, and really I wanted to celebrate you and all the hard work that you've done for our community this entire year. We want to extend that celebration though and keep it going and pay it forward. Who or what group of people, who would you like to celebrate, Dr. Niedbalski?
Well, I think I'd like to celebrate just our community in general. I touched on this before. Even though, as I stated, we're not immune to the virus, we've been hit pretty hard here at a local level. But everyone who's done their part, everyone who's been wearing their masks, everyone who's sacrificed in 2020, I want to take the time to thank them for all that they've done. I also want to take the time to thank a lot of the unsung people, a lot of behind the scenes workers at Columbus Regional, whether that be just ancillary staff, people that clean the rooms, cafeteria workers, just people that you don't even think about that have also been working hard and long hours during these difficult times.
Awesome. Well, we really appreciate you coming on the show, Dr. Niedbalski. I've really enjoyed working on the COVID-19 Community Task Force with you, and just appreciate the way that you go about serving our community. Everyone in Columbus, really want to just encourage you to continue to listen to the guidance that's coming from our local county health officer. Dr. Niedbalski is doing the best that he can each and every day. His staff are doing a great job of sacrificing themselves so that they can serve our community. The least that we can do is listen and serve right alongside with them. Thank you so much, Dr. Niedbalski, for coming on the show. Hope you guys have a Merry Christmas and a Happy New Year and a safe and healthy holiday season.
Hey, same to you, Josh. Thanks so much.